let's talk to Dr. Planty about, people who start needing reading glasses and stuff. And some of them, maybe not many, I don't know, but either way, and maybe it's bad, maybe it's not bad, and that's what we want to hear from Dr. Planty. Some of them go out there and do the 99-cent thing. I have about a couple dozen of them laying around, 2, 3 in the car, 2, 3 in the office, 2, 3 near the bed. Every one on my table has one. Well, 99 cents, literally, in the 99-cent store. 2.5, I think, or 2.25, I don't remember, something like that. I just put them on, and if I can read the shit I have in front of me, I'm satisfied. Shed some light on that. How bad, how good, how workable, how okay is it what I'm doing?
I'm going to just, what I tell my patients is something is better than nothing. So if a 99-cent pair of glasses will get done for you what you need to get done, by all means, then 99 cents gets it done. The problem with the 99-cent glasses are several. One, if you have 2 different prescriptions in your eye, the 99-cent glasses, the prescription is the exact same in each eye. Most of the glasses or lenses that are out there are made with what they call an optical center that needs to be fit in front of your pupil. And if you happen to match up with whatever's in the 99-cent glasses, as far as your separation between your eyes, you're in good shape at that particular point. The only thing that's going to probably create an issue for you is, end of the day, eye fatigue, as opposed to getting a true reading pair of glasses from an optometrist or an ophthalmologist or an optician, because they're going to match up the numbers to each individual eye perfectly, and you can kind of eliminate some of that eye fatigue at the end of the day or at the end of the week. But again, the bottom line is 99 cents does work. Something is better than nothing. It allows you to do the work that you need to get done.
Okay. Could it be that a person like me is not realizing that he has, let's say, macular degeneration? He only thinks that, like, okay, I'm 59 almost here, and, it's not that unusual to need reading glasses. So you just don't worry too much. You put them on when you read. And when I forget to take them off throughout after reading, and I get it on my car for about a minute, I wonder why the world is rather dim. My glasses on, so I take the glasses off and I see fine again. Now, the point is it possible for me to miss a major illness?
Oh, absolutely. Absolutely. The biggest thing with any kind of eye disease that's happening inside the eye is there's no pain receptors inside the eye to let you know that something is going on. Usually if we have like an injury outside our eye, on the skin or on the out cornea or on the white part of the eye, it's very painful because there's a bunch of nerves in there that respond to pain. But inside the eye, there are no pain receptors. So you begin to lose nerves. They begin to die. They begin to rot. They may be degenerative or whatever. And there's no indication to you that something's going on until possibly it's too late. Again, that's the purpose of having those annual eye visits, is just to make sure that everything is healthy. You don't have to get glasses every year. You don't have to do any other thing other than just make sure that the eyes are healthy on an annual basis.
Okay, all right. So now, having the nearsighted or the, I don't know what you call that, the reading needing glasses phenomena.
That's that word that you can't pronounce. That's presbyopia.
Presbyopia, all right. So having that thing, what are my choices? Glasses, lenses,
well, the choices are either, you can have reading glasses, you can have bifocal lenses so that when you look up, everything's not blurry, and you don't have to take your glasses off, or you can go with progressive lenses, or you can go with contact lenses that have bifocals in it. Your options, you have a lot of options out there. A lot of it's going to be just what's determined is going to be comfortable for you to get done what you need to get done. That's where we interview you.
What's the difference between bifocal lenses and progressive lenses, which you just mentioned?
Okay. That's a good question. A bifocal lens has two focal points. One beyond 20 feet down the road or across the room, and the other one is the second focal point is for reading, which is about 14 to 16 inches. So between 14 and 16 inches out to maybe about 6-8 feet, it's blurry and you can't see, but a progressive lens will take care of that to where you're able to see clearly from 14 inches all the way out to 20 feet with no interruption in vision, all clear. The difference between a progressive lens and a bifocal lens.
So progressive lens only takes care of the 16 inches?
No, it takes care of everything. Down the road, up close, in the middle, everything. A bifocal will take care of up close, down the road, but nothing in the middle. So if you're working at a desk, you can read, but you can't see the computer, but you'll be able to see somebody walk in across the room. There's going to be an area or a dead zone in there.
That's a bifocal.
That's a bifocal.
And the progressive basically has three. It's kind of like a car with a gear. You have 3 gears or you have 6 gears. You can shift it better.
There you go. Essentially, a progressive lens usually has 10 to 12 focal points, so it has like 10 or 12 gears.
I see. Why would anybody still take a bifocal one if you have dead points in between? I mean, why would I not want to see my computer yet be able to read with it? I mean, that doesn't look great.
Exactly. Progressive lenses are probably the best choice for the majority of the patients who don't want to take their reading glasses on and off 1,000 times a day, or if they have a distance visual problem. The progressive lenses are going to handle just about anything and everything that you need to see during waking hours. It is an excellent choice.
Okay. All right. I can't even get water drops into my eyes. Do you think I will be able to stand the lens?
If you can't put eye drops in your eyes, I wouldn't recommend that you try contact lenses. It's just not going to go.
Oh,
I'm one of those patients. I cannot put eye drops in my eyes. I can't put my contact lenses on, so I have my staff put them on for me and take them out for me. I'm a bad patient.
I really think, I would be one like that. I can't drop my eyes myself. If somebody else maybe does it, I'm sure, they can kind of like squeeze it open and there's no choice. And I'll probably live through it. I think I have at one point or another but I don't think I've ever been able to do it myself, I close my eyes in the shower, I close my eyes everywhere because, they shall not get even wet.
Exactly. And there's a lot of patients out there that can't do contact lens for that very reason. And not because they can't see through the lenses, but just because they don't have the ability to get them on and get them off in a convenient manner.
And
happens a lot.
Are there glasses which do the same things? You don't have to take them off and on. You just start saying, okay, I have glass on all the time. I get nice Gucci glasses. I look good. And I can see far. And
there you go.
There you go. 99 cents, I can't see far, so that's not good. I have to take them off.
Exactly.
So that whatever exists in lenses exists in glasses also.
Exactly.
Beautiful. Thanks a lot, Dr. Planty.
You're very welcome.